So I had a therapy patient that was really suicidal, like on the very line of suicide. We treated him recently and he's actually finishing up. His suicidality is gone. He did not go into any relapse at this point. He's thinking about going back to school. He's engaging in life again and ready to kind of make friends and do things. And so that's been a really huge blessing for me to see, because for months I've just been so scared that he was going to do something. So that is definitely one that's on the top of my head right now. We're doing something really special, right? We allow our patients to be loved. We have a team that actually loves each other. And it's not, a hierarchy, right? It's not the doctor and then we're like the little servants, but it is that the doctor listens to us, the NPs, our medical providers, our therapists, our TMS team all come together to love on this patient. So they don't just get one person, they get a treatment team, and we love them through the process.
So I had a patient that had ECT in the past and wasn't doing so well. And she came in and somewhat reluctant to do ECT again for good reason. The efficacy from it the first time around wasn't that great, and we discussed TMS as a second option and how about trying that, and the key being to keep trying to get better. And thankfully she did really well with it. Well, that was pretty cool. Wow is when a patient comes in and says, I'm doing better. That's it. That just reminds me of why I do it.
I remember a very clear patient who has struggled with depression for 30 years. 30 years. And she's had all the various medications, has been treated, and eventually this patient went through a period of breast cancer treatment and chemotherapy. And then, of course, which made her depression much worse, her oncologist referred her to me. When I first told her about TMS, she was a little bit skeptical, because when I talked about medication, she said, I've tried everything. There's nothing that's working. Maybe my brain is just not good. Cut the long story short, this patient will come to me throughout all our interactions. She will be in tears. She will come to my clinic in El Paso, but she lived in Las Cruces, New Mexico, which is about 30 minutes drive. She was so psychomotor retarded that she couldn't drive. Her mother would drive her to my clinic every single time. I did a few medication changes and combinations, nothing worked. And then when I put her on the machine, by the end of the first week of her treatment, 7 days, I had her daughter, who lives in Georgia, calling and say, what did you do to my mom? She's a different person. For the past 30 years, nobody could talk to her. But here I can hold a conversation with my mom without her breaking down into tears. And this is just one.